My name is Dr. Samuel Parker. I'm a fully qualified GP working in Sunderland and Gateshead. I'm a part-time public health PhD student at the Institute of Health Society, Newcastle University, and I'm a British Medical Association representative sitting on various committees including the Medical Academics and the Public Health Medicine Committee.
Yes. Why do you think that is a lower smoking rate recent in Northeast?
So the smoking prevalence has reduced in the Northeast due to a fantastic approach by various organisations within the region, including FRESH, Regional Tobacco Control Group, as well as dedicated support from various practitioners and public health individuals who realise the importance of helping people to quit smoking.
Yeah, what kind of harm will do if people smoking for long term or short term to their physical body?
So smoking has numerous effects. In the short term, it can increase the liver's ability to break down certain chemicals, which means that the drugs that we have are lower concentration in the body. Common drugs include paracetamol, diazepam, and many anaesthetic agents. It also increases vasoconstriction, so that's the narrowing of the blood vessels, which increases the workload that the heart has to do. And it causes constriction of the small airways in the lungs. In the longer term, I think from a biological perspective, it increases your risk of heart disease, respiratory problems, including chronic obstructive pulmonary disease, vascular problems, including peripheral artery disease, which means narrowed blood vessels in your legs. It increases your risks of cancers, affects you, your mental well-being, increased rates of depression and anxiety amongst smokers. And from a social perspective, it costs quite a lot to fund tobacco dependence. So a significant number of households in the UK are in poverty at present because there's one or more smokers within the household.
Yeah. What kind of the method can people to stop the smoking?
There's various different methods. The key thing to say is that with support, you are 4 times more likely to quit smoking at 12 months. You have your non-drug methods, so for example your behaviour support where a dedicated stop smoking practitioner helps a patient to overcome their smoking addiction with tips on how to navigate withdrawal symptoms. For example, you have the drug methods, so that's either the standard recognised medication, be that topical, for example, the nicotine replacement patches, which give a 18 to 24 hour release of nicotine, or the short-acting ones such as the gum or the lozenges, which you take to help you overcome the desire to smoke in the short term. There's also medications, varenicline, bupropion, to help reduce the desire to smoke, and then there's the newer agents, so e-cigarettes, also known as vaping, which Public Health England has said is 95% more effective than 95% less harmful than conventional tobacco products, cigarettes.
Yeah. So does the vape have some potential risk for the people, especially for the pregnant women?
So long-term data isn't yet available. There are concerns that some of the products within vapes or e-cigarettes They haven't been studied on what they do to the lungs when they're inhaled. However, as mentioned earlier, Public Health England say they're 95% less dangerous than conventional tobacco products, cigarettes, cigars, for example, because they, whilst they do have nicotine in it, which is the mediator of addiction, they don't have all the other harmful chemicals which increase your rates of cancer, for example. It is contentious. Strong calls in America for e-cigarettes and vaping to be made illegal. The UK and Australia are two countries that are very supportive of cigarettes, and they see the benefits of helping people to quit smoking.
Okay.
I think it's okay.
Yep.
Thank you very
Thank
much.
you.
Right.